Good morning. Welcome everyone to the FIP Development Goals Digital Program 2021, Setting Goals for the Decade Ahead. Today we'll be speaking about I apologize everyone, I'm having some difficulties here. Today we will be speaking about the FIP Development Goal number 1, academic capacity. Our moderators for today include Patricia Acuna Johnson from the Faculty of Pharmacy at the University of Valparaiso, and I'm Sean Gleason, Assistant Director for Distance Degrees and Programs at the University of Colorado in the US. Together, Patricia and I, along with Claire Anderson, one of our speakers, serve as global leads for the Workforce Development Hub, representing the Development Goal number 1, academic capacity. This webinar is being recorded and live streamed via YouTube. The recording will be available on our website at www.fip.org. You may ask questions using the question box provided. You are welcome to provide feedback to webinars@fip.org. To become a member of FIP, please visit www.fip.org/membership_registration. So, as I mentioned, the topic for today is setting goals for the decade ahead. This series is a comprehensive series of online events which provides coverage of the 21 goals over the 21 events in 2021. The outcome of the 21 digital events is to mobilize global pharmacy development and transformation through the development goals. By engaging our profession, members, and colleagues everywhere, we aim to provide a description, direction, and context for each specific goal. Monitoring and evaluating through data evidence and identifying priorities across practice, science, and workforce and education. As you'll see, we have a busy year ahead of us with the 21 events taking place, which starting this past March up through the end of the year in December. There are roughly 2 events per year representing a variety of development goals, as you see here. I do want to point out September, which is a very busy month, to align with when we would typically have our global congress, and it also aligns with Pharmacy Week. So we're looking forward to the events ahead. If you would like to register for more or see more about these, please visit events.fip.org. So the goals for today's events are to cover Workforce Development Goal number 1, academic capacity. The outcomes will be to describe the FIP development goals and explain the components of development goal number 1, along with its 3 elements: workforce and education, science, and practice. Next, we aim to showcase the FIP tools, evidence, and resources to support DG1 implementation across the 3 elements. We aim to identify priorities across practice, science, and workforce and education within development goal number 1. We also aim to engage our members in an activity to support monitoring and evaluation of the goals through data evidence. Bear with me here. Our speakers for today, I'll go over them briefly and we'll have full introductions as I go on. Our speakers for today include Claire Anderson from the University of Nottingham, Ariana Mestrovic, a consultant and assistant professor and pharmacy expert from Croatia, Pierre Moreau, Dean of Kuwait University from Canada and Kuwait, Marilyn Morris, a State University of New York at Buffalo Distinguished Professor, and Mariam Boachi Jayasi, Senior Lecturer at Kwame Nkrumah University of Science and Technology in Ghana. As we've all learned over the past year, one of the main goals of FIP is the one FIP or one FIP goals. This is important to notice how this all comes into play. We can have no pharmaceutical care without a pharmaceutical workforce, and we can have no pharmaceutical care without a scientific foundation for the next decade. So you can see how the three all work together. The 21 goals that we'll be discussing over the course of the year build on the 13 workforce development goals that were launched in 2016. And these were launched through a consensus building event, each reflecting practice, science, workforce, and education. So let's wait to hear what the speakers say, and let's see a little bit more about them in the next slide. I hope you guys enjoyed that as much as I do. I love the animation on that. Very nicely done. And I hope that gave you a snapshot of what the development goals are. So let's move on to our topic today, which is FIP development goal number 1, academic capacity. We'll be focusing on this. It's the same thing in all 6 languages represented there. So the main components that we'll be discussing today about academic capacity include the 3 elements: the workforce and education element, the practice element, and finally the science element. So let's move on.
Okay, shall I start?
Yes, please.
Yeah, our first presentation is from Claire Anderson, Professor of Social Pharmacy, Division of Pharmacy Practice and Policy at the School of Pharmacy, University of Nottingham, UK. She's the chair of the Royal Pharmaceutical Society in England. As a leading social pharmacy academic, her work focuses on designing and evaluating educational pharmacy practice and health services models and exploring patients' experience of using medicines. Currently, she's leading a UK-funded FIP project to transform pharmacy and chemistry education in Kenya. Nearly 20 years of experience in FIP education, past president of the academic section of the International Pharmaceutical Federation, FIP. So please, Claire. Thank you for having me with us.
Hello?
Hi, are you able to see the next slide, Claire?
Yes, sorry, I couldn't see myself, so I was a bit confused.
Okay.
Sorry, I don't know why.
Oh, I understand.
Okay, sorry, I thought I hadn't come up. Hello, everybody. So I'm going to talk to you about FIP Development Goal 1, academic capacity from the workforce and educational element. And we've defined that as engagement with pharmaceutical higher education development policies, ready access to leaders in all sectors of pharmacy practice and pharmaceutical science in order to support and develop workforce development agendas. Next slide, please. So what is academic capacity all about? It's about having the capacity in the workforce to provide the services that we need, and that depends on an appropriately trained pharmacy workforce, both at initial level and at the more advanced levels. So to do that, we need a competent and committed and well-trained, dedicated academic workforce in sufficient numbers. And all of this depends on having appropriately resourced academic institutions, so that our institutions have enough equipment, enough rooms, they have enough teachers who are paid enough to stay in those positions. So all those things are really important. So I'll go on to the next one, please. So how do we do that? There's lots of different mechanisms, and I'm not going to read this slide out, but things like developing our initial education and training programs so they're fit for purpose according to the local health needs and the local science needs. So for example, if a country doesn't have any pharmaceutical science, should we be training pharmaceutical scientists in that area? Or should we be training more people to work in primary care if that's where the healthcare is needed and based, and that is increasingly happening. So we need to develop new ways to attract people into academia as well, and to give people an academic career pathway. We need to have sure that we're meeting minimum national standards for facilities, for educators and for student support. So interconnected into our universities and schools that we're doing all that. We need to enhance interdisciplinary and interprofessional education. That's another of the workforce, of the development goals. So you can learn about that at another point, but we link in with that very much. And we need to think about career development for the clinical academic educator workforce. That's a particular problem in the UK. Pharmacists are being encouraged by our regulators to be much more clinical, but we don't have a clinical academic educator workforce in the same way as some other countries do. And that's something we really need to be able to develop the capacity in. And we need to use data and evidence to support investment in pharmaceutical higher education. So collecting data, doing research is really important in this area. We'll move on now, please. So my team, Sean and Patricia and myself, we're working on this. And one thing we've produced is part of the workforce reference guide for FIP development goals. And if you look at that guide, it collates a lot of information and evidence and expertise to support people to measure progress, to evaluate how they're doing with this goal. So there's a link for that there. Next, please. So our particular projects at the moment, we're working, building on work of my PhD student Iffy to develop a tool to support nations to assess education development needs. And that's based on a tool that we developed and piloted in Nigeria to help schools to develop their education. We're going to be working with the Board of Pharmaceutical Sciences of FIP on a global report on pharmaceutical science education. We're working with Chris John to develop indicators with the observatory. And we're involved in a webinar which Sean is leading, following up from our very successful webinar that we did last webinars we did last April and May on digital education in the age of COVID 1 year later, and that's going to be in June. Okay.
Thank you very much. Thank you very much, Claire. That's very engaging. So our next invitation to present is to Pierre Moreau. He is an FIP Aim chair-elect. Pierre Moreau received pharmacy and PhD degrees from University of Montreal and was appointed at this institution in 1997. He was nominated Dean in 2006 and left Canada in 2014 to be appointed as Dean of the Faculty of Pharmacy at Kuwait University, where he is leading a curriculum transformation. Please, Pierre, you're very welcome to present.
Thank you so much, Patricia. So it's a pleasure for me to be here with you this morning. First, I'll talk briefly about FIP Aim. Aim stands for Academic Institutional Membership. Basically, we are a group of faculties of pharmacy across the world. So 164 schools of pharmacy are members and representing 56 countries. And if you are interested to join, there's a QR code here on the screen that you can scan to bring you to the relevant place. So we are the only global network of academic institutions and basically working with academic pharmacy leaders, deans and vice deans and chairmen and others. And it's a very dynamic group. So on the next slide, you will see our strategy is to engage our members by what we call the 3C, which is communication, collaboration, and concentrations of areas of interest. And we do that with our annual forum that used to be face-to-face called GALF, Global Academic Leaders Forum, through webinars and leadership training. And I'll get into that in more detail, and through also soon to be collaboration platform, and also selective partnerships based on the profiles of the faculties and how we can match them to support our members developing further. So on the next slide, we will now dive into this development goal number 1 that was just explained to you by Claire. And basically, if we take the first mechanism, which is increase the capacity to provide a competent pharmaceutical workforce by fit for purpose education, we do have webinars. We had a series of webinars on how to adapt our education during the pandemic, which of course, as you know, was a big game changer. And also, how do we guarantee the quality? So we have now a working group or area of concentration that will deal with that. How do we maintain, especially if we go to more hybrid types of teaching, quality with online versus or with online and on-site education? So these are questions that deans, vice deans discuss, and this is an area where we let's say, contribute to the development goal number 1, which is academic capacity. Of course, we have our yearly forum, which always focuses on relevant topics for improving pharmacy education. And we focus a lot through on enhancing leadership. And this is something that also contributes to this first mechanism. Moving on to the second mechanism, which is about attracting young pharmacists in different areas. Of course, we need to make sure that our curriculum will interest also a varied pool of students that will allow them to develop their career into different paths. So it is important that we have a lot of efforts on recruitment of students and allowing our colleges or faculties to have a diverse offering. And this is something that we have started to do this year looking at enrollment and engagement of students. The other aspect that we do as FIP Aim for this DG1 and this mechanism especially is leading curriculum change. This is something that we need to make sure that we include science in all of those of our efforts to make sure that we are not just tackling pharmacy practice, but also developing strong scientists or a strong science base to support the practice. And this is something we had a part of our last meeting that was face-to-face in Abu Dhabi. We had a section of our efforts or discussions on the importance of science in pharmacy education. The next mechanism on the next slide is more about infrastructure and support. And as you know, deans and vice deans are key to make sure that the right budgets, the right infrastructure is provided to support education, to support the students. So by improving leadership development and also by allowing these connections between schools of pharmacy across the world, we believe we can contribute again to this development goal. We also advocate for the use of FIP developed tools such as the Global Competency Framework, Needs-Based Education Model, and the Nanjing Statements to help the schools attain the level of quality that is expected. And the last mechanism is about stakeholder collaboration. And again, deans, vice deans, and leaders of pharmacy colleges are the people that are at the forefront of these collaborations. And again, we're bringing them up to speed and improving their leadership skills. And we have, during the pandemic, created a short 4-module learning about how to apply leadership skills in difficult times or trying times. This is a special online training that is still offered. I'll come back to it in a couple of slides. So again, this is how FIP Aim can contribute to the DG1. And this is something that we've been doing for years. So if we go to the next slide, basically this is a little bit a summary of the last 3 Global Academic Leadership Forum. And you see the topics that were covered: planning, strategy, development, and change management in schools and faculties. And this came just before the pandemic, so it was quite timely. Conflict resolution, entrepreneurship in higher education, science infused into the curriculum, solving challenges through networking. And of course, last year we focused on the pandemic and how we can shift our leadership in trying times. The next slide just shows some of the webinars that we provided over the last few months, trying to bring our members up to speed on online education. Also, how do we improve the enrollment in faculties of pharmacy, especially during this difficult time, and so on. And we have upcoming workshops as well that will be done in the fall. And the last one, I think my last slide, is about this course that we have developed, which is called Enhancing Academic Leadership Horizons in Trying Times. This has several modules. You can see them there. And if you would like to register and follow this course, you can scan this code. And this module is very, very well organized, and it will give you a lot of tools. And a lot of people are sharing their experience to try to help you adapt your leadership in trying times. So that's all for me, and will be happy to answer questions if you post them.
Thank you, Pierre. Thank you so much. There's a lot of work behind, and you have shown it us very well. So our next presentation is from Dr. Mariam El-Bokai Yassi. She's a senior lecturer in the Department of Pharmaceutics at Nkrumah University of Science and Technology in Ghana. She's a FIP UNESCO Unit Win Center for Excellence in Africa lead for academic capacity in Ghana. Dr. Mariam, please.
Hello, thank you very much. Greetings from Ghana. On behalf of the FIP UNESCO Unit Win Center for Excellence in Africa, I'm happy to present to you our contribution to the development goal on academic capacity. By way of introduction, a little bit about the FIP UNESCO Unit Win program. Unit Win advances research, training, and curriculum development in pharmacy education by building university networks. Unit Win, FIP's active regional Unit Win network is currently the Center for Excellence in Africa. And the priorities for the Center for Excellence in Africa are academic capacity, needs-based education, and enabling pharmaceutical policies through advocacy. The major outcomes so far for the program have been intra-regional academic partnerships and exchanges, joint research and pharmacy program development, advocacy coalitions, enhancement of quality assurance in pharmacy education, increased academic capacity of resources. On the next slide, we are going to talk about FIP's Pharmacy in Education Sub-Saharan African report, the first of its kind report in the history of FIP and the history of pharmacy education in Africa. A decade worth of evidence was gathered in this report from the FIP UNESCO Unit Win Center for Excellence in Africa and countries across Africa. And the needs and priorities of pharmacy education in sub-Saharan African countries are captured in this report with focus on academic capacity, needs-based education, and advocacy for advancing pharmacy education and the pharmacy profession. And this report can be downloaded on the link provided on this slide. And you can also scan the QR code to download the report. And if you have any questions or inquiries about this report, you can contact us on education@fip.org. On the next slide, FIP UNESCO Unit Win program believes in academic capacity. We believe that building of academic capacity is key for the sustainable development of the pharmaceutical workforce. And in order to improve the health and well-being, also, we believe that promoting the attainment of postgraduate degrees in pharmacy will increase the academic staff strength for training of pharmacists. Staff-student ratio is one major challenge when it comes to pharmacy schools, especially in developing countries. So increasing staff numbers and expertise will also increase this staff-student ratio. To this end, the FIP UNESCO Unit Win Center for Excellence in Africa facilitates and promotes interactions and discussions for improvement of academic capacity. In the next slide, thank you very much. The way forward, we believe that in order to promote academic capacity, we need to address inequities, we need to make partnerships, we need to establish an African Association of Pharmacy Schools, and also to expand the FIP UNESCO Unit Win program, which is currently only in Africa, to other regions as well. The next slide. Thank you. So in the year 2010, the Unit Win Center for Excellence in Africa report was launched. And this report is going to support the establishment of the Africa-wide Pharmacy Schools Association. And the toolkit will be launched in this quarter of this year. And the Center for Excellence in Africa will be converted into a task force to help promote the African-wide Pharmacy Schools Association. And the FIP hopes to set up regional centers of excellence based on their different needs and interests in each region, in addition to what we have currently in Africa. And so finally, we will commence the FIP Education Transformation Toolkit and launch the new centers of excellence in the other regions. Next slide, please. Thank you. So the Center for Excellence in Africa, we believe the academic capacity is very, very important to us. And so the formation of the Africa-wide Association of Pharmacy Schools is going to benefit from the Pathfinder toolkit that we are already putting together. And this formation of the Association of Pharmacy Schools in Africa is going to benefit from the toolkit. And this association will be supported by already established associations like the European Association of Faculties of Pharmacy, the American Association of Colleges of Pharmacy, as well as the Asian Association of Schools of Pharmacy and others. This is because they have some expertise with associations and they will provide support to our African colleagues here. It will be a meeting of deans of pharmacy schools in Africa. And this is going to contribute to the development of academic capacity in the Africa region. Because, thank you very much, this is the contribution of the FIP UNESCO Unit Twin Center for Excellence in Africa to the development goal 1, academic capacity. Thank you.
Thank you, Dr. Mariam. Thank you so much. So next we have Dr. Ariana Mestrovich. Dr. Mestrovich is assistant professor at the University of Split School of Pharmacy. Social pharmacy and patient care is her area. She is Director of Professional Affairs at Pharma Expert Consultancy and Education. She is a Development Goal number 5 lead and member of the Board of the Academic Pharmacy section at FIP. Currently, Ariana Mestrovich is leading an FIP project with our Academic Pharmacy section to develop competency framework for pharmacy educators and trainers. She is an experienced FIP volunteer with knowledge of various sections boards, including the Academic Pharmacy section and Program Committee. Please, Ariana.
Thank you, Patricia. It's a pleasure to be with all of you, and thank you, dear colleagues from around the world, for joining us today. On behalf of Academic Pharmacy Section, as a Vice President of the section, I was appointed to be with you today and to share some experiences and some plans that we are trying to develop in Academic Pharmacy section. So my goal today is present the practice element of academic capacity, and as we all know, in these very challenging times, all the tools and the strategies and the best practices that we can share could be really beneficial to all of us who are dealing with the new skills and new challenges and new resilience that we need to show in everyday teaching, not only in academia, but also in continuing education. Next slide, please. So the mechanisms to achieve the academic capacity through the practice element of the development could be developing the different infrastructures to teacher practitioners to connect with each other, to share the experience, to learn from each other, maybe to participate in the joint projects and then to develop their own competencies. Then again, as previously already said, developed frameworks, standards and structures for postgraduate and advanced education and training, but also interprofessional and interdisciplinary education, which is always the highest quality in pharmacy education, to be designed and to start to learn together, to start to work together in the future in practice. And again, to develop the indicators for us teachers, how we are really performing and how we are really fit to practice today, because sometimes people in academia could lose the connection with practice, could lose the maybe connection with the new contexts like new laws or regulation, and therefore we need to be very careful about the reality check for us who are teaching students in academia. Next slide, please. Some of the projects which are in progress in lead by academic pharmacy section are listed here on the screen. You can see there are many. Some of them are already well established and in progress and with visible results, such as FIP Workforce Development Goals indicators, or better to say development goals indicators now. Then a global competency framework for educators and trainers in pharmacy that I'll say a little bit more about in a minute. Then some other initiatives, as you can see here, we are trying to develop the training programs for teachers, for academia leaders as well, so that we are able to teach others and also to share the knowledge and the best practices to others. It's a great collaboration with Young Pharmacists Group and also with other stakeholders in FIP Ed initiatives like Aim and the Workforce Development Hub as well. And we are trying also to implement practice aspects in those modules, such as learning for life, such as public health campaigns, such as digital health, and maybe toolkits for new skills, like, for example, vaccination. The last one is a very special one that we started in pandemic time, is our COVID-19 grant project for young researchers and young teachers who want to develop any kind of tools connected with the digital health or with the mental health of the students. So again, connection with practice aspects of our everyday academia life. Next one, please. This one is especially, of course, dear to me because I'm in the lead of this project, and it includes lots of stakeholders within FIP and also with our partners. It's in the stage that we are going to be validating this framework. And as you can see here, it is founded on the quality assurance house that we have built in 2014 with our quality assurance framework for pharmacy education. Talking about practice aspects today specifically, please take a look at 3 foundations: science, practice, and ethics. And then we are trying to appoint as well in this framework, which is a competency framework for educators, that we need to be connected with practice, we need to be experienced in practice, and we also need to give practice examples to the students and to our colleagues that we are teaching. So in a way, not to lose that special connection with them. You can expect from us a launch of the Framework 0 version at the very end of this year, 30th of December. And next year, some of the working groups in the academic pharmacy section are working together to develop handbook for this framework. So all of you who are teachers or lecturers or trainers for other colleagues or students will be able to evaluate yourself, but also to learn how to find good resources and good tools to develop ourselves for the future. Next one, please. Some of other initiatives that I would just like to point today quickly are some masterclasses that we are organizing, for example, on digital health for academics, which is portrayed here. And we are following also the strategic documents and the reports published by FIP, such as a really important one on the digital health and education. And following us and being our members, you will be able to know when and how you can learn more and be more competent in digital education. Next one, please. It's again a handbook to guide competency-based education. You have seen the pillars and foundations. So the competency-based means that all education needs to be based on science, on practice, and on ethics to develop knowledge, skills, attitudes, and values. And one of our working groups is working now hard to develop a handbook to guide teachers how to build competency-based education. So we can really measure before and after the teaching or the class or the school year, how much competencies were growing in our students. And the last one, please. It's just a kind of invitation to join the communication with the academic pharmacy section, because one of the tools to develop practice aspect of academic capacity is also to network and to talk to each other. So here you can see the different options that you can join. If you prefer Twitter chats, which is now recently approved, and we just started with that. We will found soon online journal club. It's also in final approval phase. This project would serve to highlight the published work of individuals within the section, but also to provide the platform to discuss and to share how we can use those things. And of course, you can read our newsletters and be connected with us on the webinars. Thank you very much for your attention. And in case you have any questions or ideas, I'll be happy to receive it by chat or in any other communication channel. Thank you very much.
Thank you, Ariana. Thanks a lot, actually. So last but not least, we have Marilyn Morris. She is a State University of New York at Buffalo Distinguished Professor. Dr. Morris is Distinguished Professor and Chair in the Department of Pharmaceutical Sciences, School of Pharmacy and Pharmaceutical Sciences at the University of Buffalo, as I said before. Her research focuses on the influence of drug transporters on drug pharmacokinetics and pharmacodynamics, and the identification of transporters as therapeutic targets. She's a fellow of American Association of Pharmaceutical Sciences, American Association for the Advancement of Science, and International Pharmaceutical Federation as a past AAPS president. Please, Dr. Morris, you can go on.
Thank you very much, Patricia, and thank you for this invitation to contribute some of the work that the Board of Pharmaceutical Sciences is performing in order to address the FIP development goal number 1. So this is the science element, institutional academic capacity to deliver quality pharmaceutical sciences education and training for pharmacists and pharmaceutical scientists who contribute to patient care, new discoveries and development, clinical utilization, marketing regulations, and the economic assessment of health products. Next slide, please. The mechanisms really are threefold: collaborate with academic leaders, professional organizations, regulatory bodies in the pharmaceutical industry to define regional and global needs for the pharmaceutical sciences. Secondly, to build relationships with relevant stakeholders to best align scientific content of academic courses with contemporary professional practice in pharmacy and pharmaceutical sciences. And lastly, inventory global pharmaceutical sciences training opportunities to broaden student access to curricular content. And you can see the overlap here with what we're addressing compared to the previous speakers. Next slide, please. So one mechanism that we are using in order to obtain this information is through the development of a global graduate education survey. And our objective is to obtain greater understanding of global graduate education in the pharmaceutical sciences. And this information really is not readily available in the literature. So our specific aims, which we're achieving through the formation of an internationally and disciplined diverse committee, are to develop and implement a survey for graduate programs in the pharmaceutical sciences. And we're in the process now of actually implementing this to be sent out in a number of different languages. And secondly, to analyze and disseminate through presentations and publications our findings. And this information will be used to identify areas for the FIP Board of Pharmaceutical Sciences for outreach programs and collaboration opportunities through FIP and globally with pharmaceutical departments. Next slide, please. So the content of the survey, information will be obtained on programs, description, competencies, and requirements of the curriculum, on faculty and student composition, numbers, as well as gender, and part of full-time. And this is an area where we feel that likely follow-up surveys will be also needed. We'll obtain information on research being done in the various pharmaceutical sciences programs, graduate teaching, what sort of courses are present, the interdisciplinary nature of the research and the programs, graduate student placement, career placement, as well as achievements of these programs, and what are the challenges of the programs. Next slide, please. So this program addresses the developmental goal number 1, academic capacity, but also will provide information on that really helps us to achieve our goals with a number of different developmental goals, including pharmaceutical sciences, early career training, advanced development, competency-based education and training. We'll also obtain information on leadership development and multidisciplinary teams. And we hope to follow up with additional surveys in order to look specifically at equity and equality in the pharmaceutical sciences and access to innovative medicine. Next slide, please. So I just wanted to recognize the committee membership. As I said, this is diverse with regards to disciplines, and it's also international. So Justin Gatwood from the US, he is also the AACP Graduate Education Committee Chair. Joe Nicolazzo from Australia, Aaron Bilinsoil from Turkey, Joan Zhu from the Chinese University of Hong Kong, Samuel Azar Kensa from Ghana, Maria Virginia Giolato is our graduate representative, and she's currently in France, but she comes from and had previous training in South America. And then the BPS Scientific Secretary, Giovanni Paletti, is ex officio. And I want to also recognize the FIP assistants that we've had with this survey. Susanna, Nilhan, and Christopher have all been exceptional in providing assistance with the implementation of this survey. Next slide, please. So expected results, outcomes, and follow-up. So we expect to obtain information on faculty members, numbers, and gender, information on students in programs, numbers, gender, international background, also placement of graduates and the reason for attrition from programs. With regards to programs, degree programs, MS and PhD programs, discipline area requirements of entering students, course content, and competency. In particular, we're interested in identifying challenges and needs. We will disseminate this information so it will be widely available for programs and our global community. And we feel through this survey, it's sort of a start to identify the role of FIP and the Board of Pharmaceutical Sciences with regards to the needs of these programs and what we can do to address the needs, providing value of membership. So we will provide information on global graduate programs. We'll also identify scientific education and professional development opportunities, as well as identify needs for travel grants, student research support, identification of collaborations and programs assistant, and also potentially faculty-student exchange programs. As I mentioned, we're at the point now where the survey has gone through sort of a pilot evaluation and is now being translated into a number of languages and is ready to be disseminated globally. So thank you very much for your attention.
Thank you, Dr. Morris, for sharing that important information. I look forward, and I'm sure the audience and members on the presentation today look forward to the results of that important survey. It looks like it's going to provide some great information. So thank you, Dr. Morris, and thank you as well to all of our presenters this morning who have covered all the important work taking place regarding academic capacity in the workforce and education element, the practice element, as well as we just heard the science element. So now let's move on to hear a little bit from our other colleagues within FIP, some important groups here. Let me see if I can pass this on. First, we're going to hear from our colleagues in the IPSF group. So please join me in watching this video from one of our students in IPSF and hear what he has to say.
Hello everyone, my name is João and I'm a student from Portugal. I'm also the president of IPSF. IPSF is the International Pharmaceutical Students Federation, which is representing more than 500,000 pharmacy students worldwide. I would first like to thank FIP for always involving us, the students, in these kind of important discussions. And as you can clearly understand, the FIP Development Goal 1 on academic capacity is quite an important one for students. We as students believe that the best way to improve our profession and to make our profession move forward is through education. So when we were asked to talk about this topic, we were quite interested because currently we are doing a global discussion on the global pharmacy workforce, preparing for the next decade, because we as students believe that the universities need to properly prepare us not only for the challenges that we will meet when we enter the workforce, but the challenges that we will be facing in the next decade and in the decades ahead. So topics like, for example, interprofessional collaboration that is empowered by interprofessional education, and also improvements to our pharmaceutical practice, including, for example, AMR and immunization, are topics that are quite important to be well covered in universities, so we students will be better prepared pharmacists when we enter the workforce. So thank you so much for the invitation. For us students, it's quite important to always advocate for improvements to our curricula, to our universities, for example, through raising awareness on an aging statements. So these are topics that are quite important. We know that the health systems will face major challenges, and for this, the FIP Development Goals and also the Sustainable Development Agenda for the UN are quite important for the pharmacists to understand and the pharmacy students to understand how will they need to step up and adapt to meet the ever-increasing needs of health systems and also the ever-increasing needs of our patients. So thank you so much and have a nice debate. Thank you.
All right, I hope you all enjoyed those words from João as much as I did. It's very important for us all. It reminds us all why we're here and what challenges we all have facing us over the years to come. So now let's hear a little bit from our young pharmacist group and understand a little bit more of their perspective. So this is Equebom, and let me get this going.
The FIP DG Goal 1 of academic capacity seeks to provide some form of build-up of academic capacity for pharmacists globally. And on the young pharmacist perspective, we seek to use it to provide some form of training and some expert knowledge to young pharmacists globally. And some notable projects of the FIP YPG which seeks to cut across this area are: one, the FIP YPG Career Development Toolkit for Early Career Pharmacists and Pharmaceutical Sciences. This seeks to provide some form of guidance to young pharmacists who have just come into the profession, and they seek to have some form of understanding of the different career paths available in pharmacy, give them some form of training as it relates to career progression, maybe career development, as well as some basic skills which they would appreciate as they are going into the profession. And secondly, we also have the one which is currently in the works, the FIP YPG Continuous Professional Education and Development Training. which the FIP is looking at it as a proof of concept. Now, this would also provide some form of training module for young pharmacists where they can access it through the FIPX platform and get their trainings, and depending on whatever topic they can relate to. So these are just quite a number of ways in which the FIP YPG is inculcating the FIP Development Goal 1 of academic capacity into its project. Thank you.
All right. Again, an important view from our young pharmacist group, and in this case, showing where the importance of continued training with various programs, including the toolkit provided, are so important for the continuing enrichment of our academic capacity. So with that, let's move on to the important, excuse me there, to the next important part of our session today, which is the panel discussion. So I'd like to invite you all to submit your questions. I've seen a couple along the way in the Q&A, but please go ahead and add some more. And we'll wait a couple minutes for you to get those questions in, and then we will ask the panelists to join us in our panel discussion.
Sean, there was a question about the work package we're developing with from the Nigerian work. Yes, that will be available to everybody. So I just wanted to say that so that everybody could hear.
Okay, thank you so much.
Sean?
Yep.
There is a question in Q&A from Maria Isabel Sanchez. Have you read it?
No, let me go ahead. Thank you
Yes, please.
for pointing that out. So Maria Isabel Sanchez, I'm not sure, Maria, which part of the world you're from, but you have an important question here. Maria's question is, how can we challenge the professionals into the academy and investigation for advanced graduation again after a long time just working? How can we demonstrate that their experience is very important to the knowledge of the difficulty and the implementation of new opportunities? And Marilyn, I should have told you this ahead of time. I believe this question came in when you were speaking. And please let me know if you'd like me to repeat that.
Yeah, can you repeat it? I was just trying to find the question here.
Yeah, so it's in the Q&A box, but I'll repeat it again. So how can we challenge the professionals into the academy and investigation for advanced graduation after a long time since working? How can we demonstrate that their experience is very important to the knowledge of the difficult and implementation of new opportunities? So
very good question. You know, certainly there's a need for experience, and that certainly adds to sort of the scientific background and the practice background of all individuals. And so these individuals, again, can have increased really, I think, through professional development and some of the scientific programs through the FIP can certainly, elevate their status with regards to contributions in both the Board of Professional Practice and the Board of Pharmaceutical Sciences. And so certainly are welcome to contribute in both areas.
All right, thank you very much. So let me just check. I don't think I see other questions. So if there are others that that you all have, please, again, put them in the Q&A section. One question I had, while everyone else is getting in some other questions, one question I had for Pierre was, I noticed that you talked about AIM's work in bringing more applicants and more students into the profession, and considering, you know, the varied interests and maybe changing interests, varied interests across local regions. And I noticed you said this is going to be a current area of concentration for AIM. Can you tell me a little bit more, just kind of what your thoughts are, and what you guys are thinking is a good way to address this, and, you know, across regions? I think we all might be sharing the same issue, but maybe in slightly different manners.
Yes, sure. Thank you for the question. Well, basically, we know that the needs are not, you know, uniform from country to country. So I think as FIP Aim, we're always advocating for doing proper needs assessment to start any process of either curriculum change or adaptation, to make sure that, you know, you're not following global trends, but you can follow global trends, but also be relevant to your own country. So that's the first thing that we advocate for. And there are very easy ways to do that, but it's time consuming. And sometimes we're very excited and we jump quickly into wanting to change the curriculum without, you know, taking the time to ask the questions first. So this is the first element. And then once you have, let's say, the profile of the graduates that you, or the profiles of some graduates that you may have, you have to determine which one, you know, which profile we will maybe focus on for undergrad education, which profiles may be better suited with postgraduate education. For instance, you know, the pharmaceutical industry may require MSc and PhD in specific areas. So these are the things, again, coming from the needs assessment that you have to address, and then adapt and adjust your education, let's say, offer to meet that. So these are the questions. And of course, then we need to make sure that we advertise this well, that we reach out, you know, with social media today. You can, you know, do it or break it. If the social media is not in your favor, you have to find ways to kind of be in the discussion. And this is something we have done here in Kuwait quite successfully, being able to get into social media and advocate for the profession, for the advancement of the profession, the role of the pharmacist. And I think we were quite successful. We had the numbers showing that, you know, we generated double the interest in getting into pharmacy than in the previous years, with changing our curriculum and advertising it through social media. So these are ways, you know, that the youth is using on a, I would going to say daily basis, but on a minute basis. And these are the things we really have to address and focus on to make sure that we reach them and tell them the real story, so that, you know, because there's so many opinions, so many messages out there, I think it's important that we are part of that, trying to provide the message that you want and not the message that is distorted by others. So if you're not engaged in the communication will happen anyway. So it's better to try to kind of control what is being said. So we say control the narrative. So these are ways that you can reach out to more potential students, giving them, you know, the breakdown of what they can expect from your education, and hopefully, you know, trigger their interest. So these are, again, our working group will start soon. We had a webinar on that at the beginning of the year. This is an area where a lot of schools are struggling and they need to find better ways. So this is definitely one of our first effort, and we're planning to organize a workshop for FIP Aim members in the fall to really work on that, you know, more in more detail. So again, what I said is my personal experience with some of the early discussions we had, but there's there's a lot of potential avenues to explore, and this is what we'll be doing in the fall with our workshop, bringing deans and vice deans from around the world, discussing their issues, but also looking at potential solutions that could apply globally or locally, depending on, you know, what is the situation.
Wow, thank you so much. A lot of really important information there. One thing I learned from you is really the importance of the needs assessment. I like what you said, that sometimes we get excited to jump on to something we see. And I can share with you at our school just yesterday, or maybe it was 2 days ago now, we had our convocation activities, and we noticed how many of our students were going into the pharmaceutical industry. And granted, we've always had that, but we've been very much a patient care focus. And Dean Altieri and I were commenting, wow, you know, there's a lot. And we've talked about perhaps we need to add more of that to our curriculum. But I think I've learned a real important point from you, that we really need to assess what is the real need out there. Is this just a one-year trend we're seeing among our students, or is there more that we really need to think about to add? So thank you for sharing that, as well as all the other important information. So I do think we've had...
Sean, I was going to just add to that as well. I think it's such an important area. And I think that's one thing that we really wanted to focus on through surveys, is what are the challenges and what are the needs of these programs? And so that we can address that as an organization. And I think we'll provide really important information for students about, you know, international programs. What are the requirements? What are the competencies? And also for faculty and universities, in order to identify potential collaborations and potential scientific and professional information that will benefit the programs. And so I'm really excited in working with everyone at FIP in order to address, you know, this such important issues for both students and faculty and practitioners. So thank you.
Yeah, thank you. And Marilyn, please keep your microphone open, because there is a question in here, and it may have been addressed with some of what you just said, but I'm not sure if you see it here. But Adalu Rhoda is a pharmacy student in India, and she asks, how do we get more exposure for the tool, and how do we get the tool to work for us, as we are often ignored in student exchange programs?
So thank you very much for the question. You know, so at this point, we're surveying programs. And so we will be able to provide more information on different programs that are available internationally. And with this information, we really want to identify really the need for student exchange programs and universities that, you know, that could benefit from such programs. And so this is really one of the areas that we're very, very important. You know, it's very important, and we really want to identify. And so hopefully by later this year, we will have more information on international programs and start to identify collaborations, including student exchange programs. Thank you so much for the question.
Yeah, thank you. And thank you for answering it. A question for Ariana. How do preceptors and trainers link to academic capacity?
That's a nice question. I love it. Thank you very much. I think it's a natural connection between academia and practice, that people from academia a little bit maybe distanced from the practice at the moment, are in a need to connect with the colleagues who are still there. And in the same time, people who are in practice need to be fully updated with the new knowledge, new skills, because new generation of students will come to the pharmacy and will expect to be mentored by people who are maybe there for 20 or 30 years. So we now have some generational issues, and we also have some clashes between what we should know, do, and be as the preceptors and the trainers. So we consider preceptors and trainers as a staff of the faculty, but located in the practice. And I think in academic pharmacy section, and also in all educational initiatives of FIP, we are trying to encourage faculties to keep them close to update them, to invite them, to include them, not just to teach them and to update them, but also to be infected with the new knowledge and with the new streams from the practice. For example, in some regions of the world, like in Europe, when I'm based, we are now trying to learn from practitioners what are the new needs of the patients. Screening tools, vaccination, which is slowly approaching in Europe, not so fast as in some other parts of the world. New subjects, new topics on curricula should appear quicker if we keep that connection close. So for all of the colleagues on the webinar who are either practitioners or academicians, this is the invitation actually to keep that connection sharp, strong, and warm, because it's a need. It's very necessary.
Wonderful. Thank you so much. I couldn't agree with you more. Serving on many committees where we do have our outside practitioners serving with us, they often provide, they're the eyes and ears, like you said, of what's really going on in practice. And importantly, like you said, now, what are the changing needs of the patients? They're on the front line. So thank you for sharing their importance. I'm looking at the time here, and we have about 3 more minutes. So I want to ask the audience members to please, if you do have questions, please do type them into the Q&A section. And while you're doing that, I do have one more question, and this one is for Mariam. So can you please share the importance of collaboration between countries for developing academic capacity?
Thank you very much, Sean. So one of the key things that has really benefited the Center for Excellence in Africa is that all the pharmacy schools in Africa have collaborations in terms of academic capacity. When it comes to curriculum development, we support each other. So for example, a pharmacy school in Kenya and a pharmacy school in Ghana can have a collaboration where they look at each other's curriculum to improve it. There's also exchange programs whereby a faculty member in one country can go and spend a few weeks in another country in a pharmacy school just to learn about the best practices there. And that is why we want to take the FIP UNESCO Unit Twin Center for Excellence in Africa. We want to take it global. So now we want to make sure that all the other regions, like the Europe region, the Asia region, the America region, they all have their own centers for excellence, so that together, the Unit Twin is whereby we learn from each other. So there is a lot of collaboration, and it has really helped to especially build academic capacity for pharmacy schools in Ghana and also in other parts of Africa. And that's the reason why we also want to have the Association of Pharmacy Schools, so that to also further improve and foster more collaboration between the pharmacy schools. And we are hoping that the Association of Faculties of Pharmacy in Europe, Association of Colleges of Pharmacy in America and Asia can help us and guide us as to how they have successfully implemented this. So collaboration is very important to us. Thank you.
Wonderful. Thank you so much. It's so important that learning can also take place both ways. We all learn from each other along the way. So thank you. And, in speaking about the differences across countries and regions, I have a question for you, Claire. Can you please share with us from your experience discrepancies or differences that you've seen in curricula between the different regions of the world? That maybe that will help us understand a little bit about what others' challenges are, etc.
I think our curricula vary incredibly. Some are very clinically focused, with a lot of time spent on rotations or placements, whichever you call them, in practice, and learning from preceptors in practice, whereas others are still incredibly pharmaceutical science-based initial education for people who are going to graduate and be pharmacists, but they're doing a lot less clinical. So it's incredibly varied. And we also have different titles for these programs as well. So there's we have the M-Farm, as does Australia and New Zealand and some other countries, and Europe. The US have the Farm D, and other peoples have B farms and BSCs. So it's incredibly varied, and we need to understand some of the differences and some of the similarities, because I think the M-Farm that we're moving to in the UK certainly will be very much like the Farm D, because in the UK we have a foundation year at the end of the 4-year M-Farm, which is a bit like the rotations that they would do in a Farm D in the last year of the Farm D. And some are graduate entry, some are straight from high school entry as well. So they're just incredibly varied, but we can all learn so much from each other. And I know for me, when we've been developing our curriculum, at Nottingham in particular, I've really valued coming to visit your faculty in Colorado and learning from you how you do things. And I think we can all learn so much from each other. I've learned a lot working with colleagues in Africa and colleagues in Australia, colleagues in India, everywhere. And I think we must always be open to learning from each other, because we can all help each other make our curricula better.
Absolutely. Thank you so much. I mean, I agree. There are so many differences, but importantly, you also covered really what the similarities are. If you put the degree program side by side, you really do see a lot of similarities.
Definitely.
And I'll just say back at you, I just talked about in a recent meeting about how in the UK, you guys have prescriptive authority. And so you've done a lot of education to get there, something we can learn from you all. So again, everything works both ways.
Just to add, our students who start this September, when they graduate from their M-Farm and foundation year, will be independent prescribers. Everybody.
Wow.
Massive change. So now we've got to educate the rest of the workforce as well. So that's fantastic and exciting.
That is fantastic.
We can help others with that.
All right. Well, I think we have covered all of, I'm going to give one more question. Claire, what part of and if you could answer this quickly, what part of the curriculum, this will be our last question, what part of the curriculum do you think the PharmD should focus on more? And it looks like that's coming from a student.
That's difficult for me because I'm not running a PharmD. Does somebody who runs a PharmD answer that? Would you like to answer?
Yeah, so I'm trying to put on my thinking hat here at 3 in the morning. What should we focus on more? Well, gosh, one of the things, like I said, that we just brought up in our curriculum committee meeting recently was the fact that we're aiming to have more prescriptive authority. So it is really more assessment and diagnosis of disease, I would say, is one major area. And then, of course, all of the, to use a term, the soft skills, the empathy and kindness and patient understanding, I think is something we all need to continually work on. And that's so important. So anyway, so thank you for that question. So we do still have, so a big thank you to our panelists for being available to answer all those questions. And we do still have some important information that we'd like to cover in this session. So please, let's move on. If I can get my slides to move on to some other important announcements and some important information. So next up, episode 6 of this series is regarding development goal number 21, sustainability in pharmacy. And that will take place on June 9th from 1400 to 1530 or 2 p.m. Central European Standard Time. I hope I got that acronym correct. And so then we spoke earlier about the importance of monitoring and evaluation of development goal number 1. So please join me in welcoming Christopher John, who is the FIP lead in the monitoring and evaluation. So he will tell us more about how FIP efforts are taking place in this regard. So welcome, Chris. The floor is yours.
Thank you, Sean. Hi, everyone. I will just be talking very briefly about The FIP Global Pharmaceutical Observatory, which, as Sean says, will be key to monitoring the development goals. And today we are particularly focusing on Development Goal 1, academic capacity. So the FIP Global Pharmaceutical Observatory's mission centers around data, intelligence, advocacy, and reporting. We certainly know from the COVID-19 pandemic the importance of data, and for data to provide us with evidence, and for evidence to provide us with intelligence. So our first task is to collate valid global data on workforce, education, practice, and pharmaceutical science. And you've heard Marilyn talking about some data collection that is underway around postgraduate training programs. That's a very good example in the workforce and education axis. But we must also undertake comprehensive analyses of collated data to provide accessible, high quality intelligence. And all this must be communicated innovatively to promote our member organizations of FIP and our academic institution members, their impact on health and education. So this communication will often be via what we are calling the FIP Atlas, which is our visualization platform for displaying our intelligence across the globe. And what we can do with academic capacity is input academic capacity data into that atlas, so you can go around the world and see what academic capacity looks like around the world. Finally, we provide evidence-based strategic information, reports, and guidance on the application of pharmaceutical science, policies, practices, and services. Next slide, please. In the interest of time, I won't go through all of these influences and outputs of the GPO. You can see them on the screen now. The main focus for today is health system strengthening by tracking progress against development goals. I mean, you could also add that, particularly with respect to academic capacity, it's education system strengthening as well that this will track. Current GPO actions and projects that are underway, again, you can see on the screen now. One of our big projects this year is called the METNA project, which is Multinational Education and Training Needs Assessment project. And this is a first global pilot of mapping education and workforce needs assessment. And we're using the FIP development goals as a framing device. So we're aiming for data retrieval in partnership with member organizations and others using the project to develop a comparative assessment in terms of priorities across regional commonalities. The main aim of the project is to address multinational needs-based education for the pharmaceutical workforce in a cohort of nations across the globe and to evaluate policy gaps on a regular basis. As I previously mentioned, we're also working on the Atlas, our visualization platform. And we're advised on the strategic direction of a lot of our work by the Data and Intelligence Commission, who are also giving us some advice on how we develop our microsite and our database. But finally, the reason why we are here today is we have an important project that aims to produce indicators that will measure and monitor progress towards the development goals. And this is where you all come in. Next slide, please. So FIP is now seeking to develop indicators and country-level metrics to measure and monitor progress and the performance of the implementation of the development goals via the FIP Global Pharmaceutical Observatory. So just in the minutes that are remaining in this event, we would really be grateful and seek your support for this Global Indicators and Metrics project by contributing to this brief activity, which we hope you will find enjoyable. And it's linked to the academic capacity digital event. So it's relevant to what you've heard today. And we would like to know your opinions about how academic capacity can be monitored and measured. And this activity is a simple and quick tick box exercise. You'll also receive an email to complete the activity, but you can paste the link on the slide now or use the QR code on the right-hand side of the slide to take part in the activity. So that's all I had to say. Thank you so much for your attention, and I hope you enjoy giving us a bit of advice via the activity on how we measure academic capacity. Thank you so much.
All right. Thank you so much. I've got to get that QR code on my phone and see if I can take part in that. So Patricia, did you want to close us out?
Yes, sure. Thank you, Sean. Well, this morning has been morning for me, maybe afternoon for others, has been great. I would like to thank all the panelists for their engaging presentations. We realize there is much more work and initiatives to be done. And also, I would like to thank the audience, colleagues and students from around the world that made this discussion possible, and for being with us the whole presentation. Thank you very much, and thank you to Marwan and all the people that worked a lot to have this today, and to you, Sean, especially for what you've done. Thank you so much. Thank you so much to all of you.
Thank you, Patricia. And then I echo your gratitude toward everyone else at FIP, as well as importantly, all of our panelists today. Thank you so much for your expertise and your time this morning or evening, afternoon.